the mental health impact of climate change, I'd put right at the top. We talked about vector-borne disease. We talked about acute disease of the heart and the lung and asthma and pollution. And I'd put mental health equal to, and in some ways even surpasses that. We know today that there are more suicides on hot days than cooler days. We know that on hotter days, there is more admissions to hospitals for anxiety, for depression, for the exacerbation of bipolar disorder. In addition to that, there's more crime, that the overall incidence of violent crime is up anywhere from 6 to 8 to 9% on these hot days. Then if you look at a whole nother area of climate change, of natural disaster. I mention all that because these natural or unnatural disasters that we're seeing with increasing frequency affect the mental health of people because they're separated from their medicines. They're separated in terms of anxiety, worry. The post-traumatic stress syndrome clearly documented after each of these natural disasters. And that spills over into caring for loved ones, into divorce, in terms of relationships. It makes sense when you really think about it.
Today's PSA is delivered by Senator Bill Frist, MD, a physician and former United States Senator from Tennessee. Driven by a profound dedication to public health and service, rooted in his extensive background in medicine and government, Senator Frist passionately tackles the urgent challenges posed by climate change to our environment. His leadership exemplifies a steadfast commitment to safeguarding our planet's health for future generations. My name is Dr. James Hildreth, and you're listening to Public Service Announcement. To learn more about this show, or to learn more about Meharry Medical College, visit www.mmc.edu. Senator Frist, I just want to thank you so much for agreeing to be part of this podcast. I'm a big fan, and certainly your impact in health and health policy has been quite profound, and I'm just excited to have you here on the podcast with us.
Thank you. It's great to be with you.
So how did a Senate Majority Leader, cardiac thoracic surgeon, make the transition to being interested in climate change and how that affects health?
I dated back. First of all, I spent 20 years in medicine doing heart and lung transplants and the training to get there.
Yes.
And then 12 years in the policy world, doing a lot of healthcare, but other things. And then the last 15 years or so doing innovative things around climate and nature, starting companies around vulnerable populations and working in community health and public health. So I really date my initial introduction back to being a doctor when I would go overseas, predominantly to Ethiopia and most of the time in Kenya and south of there. And it became very apparent to me that the diseases, many of which are vector-borne diseases, things like malaria, we didn't have answers to. And as I would see patients doing surgery, not cardiac surgery, but general surgery on these yearly mission trips, 2 weeks to a month even, that there were about probably almost 800,000 predominantly kids dying of malaria, a mosquito-borne disease, a vector-borne disease that we can probably talk about later. And now I see that there's a whole range of mosquitoes increasing over time, and therefore malaria spreading. And climate plays a huge role in this expanding range. And then about 12 years ago, my wife had this mysterious illness, and it ended up being alpha-gal disease.
Oh, yes.
Alpha-gal, which at that time was not common here in Tennessee at all. Doctors were missing it all the time. But it's a lone star tick that, again, its range and length of time in this part of the world increased. And it took about 8 months to diagnose it, and miserable. And it's an allergy to beef and pork that she has today, but at least we know what it is.
Yes. Wonderful. So why do you think it's important, even crucial, to make sure people understand the link between public health and climate change?
You know, the intersection between health generally and climate is one that is full of facts, full of data, full of evidence, yet it hasn't yet generally been applied to policy, some good policy, but not full policy yet, to our healthcare provider system, or to the average person listening to us right now. How does it affect me? So the health part of that sort of Venn diagram of overlapping climate change and health, I divide maybe too simply to individual health. I was a heart surgeon. I'd take care of one patient at a time. Critically important to me when they walked in the room and I was going to transplant their heart. Nothing else mattered in the world. And then public health, which is more community health, which is more the health of our cities and the health of our communities, and the public health of populations. And what I think both about those. I kind of mix them up. But what I like is taking the public health approach is it gives a system of addressing a seemingly insurmountable problem of climate change. The public health model, which is a specific model that I hope we can talk about, when you apply it, all of a sudden you understand that you do need to make the diagnosis. You do need to go by the root cause. There are things you can do for prevention. There are things looking ahead that you can do at scale, and you need to measure them. All part of the public health model, which I think the more we can do to have people understand, the better we'll be able to not just to understand, but act on this challenge.
Well, one of the things that became apparent to me in my work during the COVID-19 pandemic is that we may be the only developed country in the world where public health and healthcare are viewed as separate entities. And it seems to me that based on what you've said and what I've learned from you is that we got to find a way to reconnect them or to reintegrate them, which is, I think, what you're talking about.
Yeah, and I think both you and I spent a lot of time communicating this, especially during COVID. And I think we are, as a society, in a much better place today in that people see it's not two different worlds, that if you're going to address individual health and community health and population health and global health, it's all one and the same. And that coming together of what had been disparately viewed in the past is, I believe, the teachable moment that we have today.
Yes.
We can't forget those lessons that are coming out of COVID today. And I think this area of increasing natural disasters, part of climate change, the heat that's increasing, we all feel it every single day as we came in to do the podcast. You feel it with climate change. It gives us opportunities to explain it together.
So what do you think it will take to finally convince the majority of the public and even our leaders that climate change is real? It was very striking to me during the pandemic that there's a part of India where people actually saw the mountains for the first time because factories are closed, no cars on the road. The air was completely clear and clean. It was striking to me that there were adults who had never seen those beautiful mountains before, which proved that human activity, at least, is in part causing all of this.
The overall incidence of a lot of the impact of climate change diminished during those 2 years with COVID. As fossil fuels were burned less during that period of time, and there was less transportation, less industry, that asthma incidence fell down. Cardiac, my field of heart specialty, fell down, the inflammatory component, a natural observational experience that we had today. So then our challenge is how do we make that real for the future so that people will act on it? And it comes down to communication. First of all, from a political standpoint, it's a partisan issue.
Absolutely.
What is climate change? And people say, well, even if there is climate change, how much of it's really due to people? And you hear it all the time. So we need to depoliticize the language around it. If basically you start talking about climate change, there are a certain group of people who turn off totally. They won't listen at all. They'll go in the other room. Other people might say the world's going to fall apart. It's going to explode in the next 5 years. Well, it's not going to do either. And to be able to bring people to the table, to depoliticize, and one way to do that is to talk about their health. How is it going to impact you and your family and me and my family and those grandchildren that are being born today And if we can start talking about it in those terms, as individuals, as communities, people will begin to listen. So it gives us, again, a portal, an entryway by talking about how is this going to impact me and my health and my well-being and the intimacy around that, because I do care about what happens to my kids and grandchildren and their children.
Absolutely. I agree. One of the things that you mentioned earlier that people need to understand is that climate change can influence vectoral-borne diseases, infectious diseases. And I think that that's certainly something you might help our audience understand. What is that connection between climate change and the likely increased spread of infectious diseases?
Yeah, I mentioned that I was sort of introduced to the impact of climate change, or my antenna went up when I saw this whole vector-borne disease. And I kind of look at all the impact on individuals and sort of how it impacts us acutely with heat and cardiac disease and heart attacks and stroke, and then vector-borne disease, that second big category that we're going to talk about now. And then thirdly, mental health that I know we'll come to, and,
yes.
and then vulnerable populations. So what is vector-borne disease? Vector-borne disease, it's transmissible. It starts, and what the vector is, it starts in an animal who transmits that disease to a human. And that's what we mean by vector-borne disease. Mm-hmm. So immediately you think of mosquitoes,
yes.
which kill today, again, 700,000 people globally. Most of them are children. You think of ticks, especially being here in Tennessee where we
yes.
are today. The Lone Star tick I mentioned, but always a longstanding hotbed for ticks. But now we're seeing a lot more of those ticks, and ticks we'd never seen before because of climate change, in large part because of climate change. Not everything.
Right.
We see more deer,
yes.
but all of it. So we don't want to overstate it, but we're clearly seeing a lot more because of climate change. And fleas, those are sort of the three vectors that we see today. And they are on an upsurge around the world, whether it's malaria. And again, to kind of clarify things, it's not COVID or SARS or sort of what we went through directly. The vector-borne disease go through an animal host. And as those animals, whatever they might be, whether it's a tick or a mosquito, as they get transmitted around, these vectors get transmitted around, and there's expanded range, things coming north, you see more diseases. The different types of diseases like West Nile virus, something you and I studied in medical school, but it was never in the United States.
Right, exactly.
Well, it's in the United States. Or you think of chikungunya disease, which, again, was something we studied about, but it was never in the United States, and we're seeing it for the first time. So an expanded range, and as things warm up, more activity and more intensity.
Well, there's a lot there. So the other thing that I really want to touch on, because I think you have maybe some unique perspectives on this, how does climate change disproportionately affect marginalized communities, which we at Meharry Medical College have been focused on since our beginning way back then in 1876. So how does climate change, or why does climate change disproportionately affect marginalized communities?
You know, one of the things that I think COVID also gave us the opportunity to more fully appreciate is the disproportionate impact that diseases, and climate change is a perfect example of an environmental impact on vulnerable populations. And the populations, just to set the stage, could be young people, which climate has a disproportionate impact on the very young. We're talking about is a vulnerable population for climate change, pregnant women. We think of our seniors, our elderly. We think of people of color. We think of people who geographically live in districts that have had a discriminatory nature of redlining in the past. And these are the populations. So it's not just, a vulnerable population, the frail elderly.
Yeah.
It's a broad population.
Right.
And we can open up. I'd love to hear your thoughts as well. You're the world expert on it. But in my mind, I think about it pretty simply, that areas that have had infrastructure that in some ways has been disadvantaged in the past. It may be because of discrimination. It may be because of geography. It may be because they're in a heat island, an urban heat island. We're in the middle of these cities because of energy being used and lack of trees, it gets a lot hotter in the middle of it. You put all of these impacts together, that when you have, it could be a vector-borne disease that we talked about. It could be increased pollution, which is part what happens with climate change. As things warm up, pollution, the impact of pollution is amplified, like on the heart. So I'm a heart surgeon. As I traveled around the world in the countries that I'd operate in, places that had higher pollution had a much higher interest of inflammatory heart disease and stroke and cardiovascular disease. So you see all of a sudden how it comes together, where if you have heat going up, amplification of pollution. Pollution causes cancer in the lung. We've proven that. Papers have been written about it a lot in the last few years. Increased in cardiac disease, inflammatory cardiac disease, in populations that don't have an appropriate infrastructure, that the people we talk about may not have the access to the healthcare facilities. They may not have the transportation to get to the healthcare facilities. They may not have the available resources to know about how you prevent the impact of climate change over time.
Senator, you bring a unique combination of policymaking as a Senate Majority Leader. You've actually been a practicing cardiac surgeon. You're so deeply involved in policy. What would you say are some of the ways that policymakers and our leaders could take to better support vulnerable communities who are impacted by climate change?
You know, my 12 years in the Senate clearly led me thinking about policy a lot more than your typical person coming in. You know, what can be done from a policy level? And it's a good time to talk about that because, you know, we have elections and we have people disgruntled and disappointed and walking away from policy and politics in Washington and state government. And we can't do that. We can't do that as citizens, as Americans today. And here is why. Individuals can do certain things about climate change, and it's powerful how much they can do. But one of the most powerful things they can do is vote, and vote in such a way that can affect policy. If we just look to the past, out of all this despair, just 3 years ago, the largest, best, most productive policy ever passed in America, maybe I can exaggerate that, on climate. It was called the Inflation Reduction Act.
Yes.
Forget the name of it, but what it did is put $400 billion into climate change. Bipartisan, passed by the Senate, the House, and the President of the United States in this time of extreme partisanship, but the biggest climate change bill ever passed to help the globe as well as Americans. And what it did, it didn't solve it. It's kind of a down payment for what we need to do.
Right.
But the fact it was done, it looked at how we can look at alternative sources of energy. It looked at battery supply. What it will do, if laid out, if completed, will lower by 2030. That's just, 6 years from now, 40% of the bad bioemissions in this country. That's what this one bill will do. And it has passed. There's policy on the table now, and we can look at state policy, federal policy. There's a bill right now. Actually, there are 3 bills that I just wrote about, and we can put in the show notes. But one of them is the Recovering America's Wildlife Act, RAWA. But what it does, it looks at the role of biodiversity and how biodiversity, whether it's species of birds or animals or pollinators or plants or trees or land or tall grasses, that biodiversity both has adaptation and mitigation aspects around warming.
Absolutely.
Heat index. It's a bill that will pass the United States Congress here in the next several months. There's another great bill called the U.S. Foundation for International Conservation Act. The name doesn't matter, but what it does, it looks at vulnerable populations around the world and uses the power of the federal government to help lift up those countries in terms of climate change. Because remember, fossil fuels are mainly used by countries like China and the United States.
Right.
Well, the people who pay much of the pain for that and the price for that are poorer countries who don't have the resources to respond.
Exactly.
And that particular bill does that. And there's another bill before Congress called the Water Resources Act, which, again, an important bill. What's important is that people know that policymakers are acting, and in a bipartisan way. At our state level, well, how does transportation affect climate change? Well, it does when you think that our stoplights here in Nashville, Middle Tennessee have never been coordinated.
Oh, my
and
God.
therefore, people are having to start and stop 50% more than they need to. Every start and stop puts more of those bad gases and emissions up in the air. That causes more asthma, more cancer, more pollution, more Bill Frist heart disease, type of heart disease. So just by coordinating the stoplights, something we're the only one of 40 cities that hadn't yet done, even transportation bill policy level matters at the local level.
And the other thing, Senator, is that if you have a great public transportation system, you take some cars off the road, which will also have an impact, which would be quite profound.
That's right. It has a huge impact. And the sidewalks.
Yes.
Another part of that legislation puts in sidewalks. People think we're a walkable city. We're terrible compared to the other 50 sort of metropolitan areas our size. But sidewalks give you good exercise. I love that. You love that. As physicians, healthier people, healthier immune system can respond to disease much, much easier.
Absolutely. I think parks and having places that promote physical activity is really critical. And oftentimes, vulnerable populations don't have access to those things.
I'm going to quickly just give a plug. Both you and I support a group called Nashville Health. And Nashville Health is a nonprofit that looks at a community level what we can do for the health of Nashvillians. And one of the interesting things that we found is that in terms of our green spaces here, not bad in terms of if you look at all of Metro Nashville, amount of green space there. Again, not bad means we're not at the bottom as we are on a lot of other things in terms of our population health. But the distribution of those parks is terrible here when we talk about vulnerable populations. And again, the vulnerable populations are broadly defined as we have. And a lot of our green spaces are over in a part of Nashville, West Nashville, which is great for West Nashville, but it's not geographically located where it can have the impact in mitigating and adapting to things like climate change.
And I want our listeners to know that Senator Frist actually founded Nashville Health, and the concept to me was quite powerful because it brings together different groups interested in promoting health to collaborate for change, and I think that's the approach we need. So one of the things that many people may not realize is the profound effect that climate change can have on our mental health. And I know that that's something you've been focused on. Could you share some thoughts about that?
The mental health impact of climate change, I'd put right at the top. We talked about vector-borne disease. We talked about acute disease of the heart and the lung and asthma and pollution. And I'd put mental health equal to, and in some ways even surpasses that. Part of climate change, we have heating, the heat index, it's hotter now than it's been in millions of years. And that's going to continue.
Right.
So you have the heat index, which is something that people feel and that they feel it every day. If you take just that, we know today that for mental health, that there are more suicides on hot days than cooler days. We know that on hotter days, there is more admissions to hospitals for anxiety, for depression, for the exacerbation of bipolar disorder. So we know there's a direct correlation in terms of severity of mental illness. So that's the heat, sort of the heat component of it. In addition to that, there's more crime, that the overall incidence of violent crime is up anywhere from 6 to 8 to 9% on these hot days. Then if you look at a whole nother area of climate change, of natural disaster, we were seeing natural disasters that reached a threshold of costing $1 billion, costing society $1 billion. We were seeing those about once every 82 or 83 days, and that was in the 1980s. Today, that 82 days of seeing a natural disaster that's costing society more than $1 billion every 18 days.
Oh, wow.
82 to 18 days. Every 18 days, this country is seeing a natural disaster. And those costs, that $1 billion cost, is in human life, it's in hospitalizations, it's in lack of access of care. That's about 50% of those costs coming in. I mention all that because these natural or unnatural disasters that we're seeing with increasing frequency affect the mental health of people. It affects because they're separated from their medicines. They're separated in terms of anxiety, worried. The post-traumatic stress syndrome clearly documented after each of these natural disasters. And that spills over into caring for loved ones, into divorce, in terms of relationships, all of which it makes sense when you really think about it.
Well, I think that that should be understood by all of us, that these natural disasters are coming more and more frequently. Me, myself, I perceive it living here in Nashville, watching what's happening around us. But one of the things that I really believe is we need collaboration to address these things. And so I think you've been in a great position to give some advice about how do we get the public health and healthcare sectors to collaborate with other industries to address this issue of climate change and health. How do we promote collaboration?
The public health model is a specific model that can be applied, and we've learned this from COVID, as you said. We kind of understand what that model is. It's second nature to you, but most of the people listening to us, and to me not that long ago, I didn't fully understand it. But a big part of that model of using data to make a diagnosis and then going back and getting root causes and prevention and then moving ahead, a big part of that is collaboration. And with collaboration, you need communication. And that's kind of where we open the ability to communicate, not to scare and not to overstate and not to throw biases in, but to state the facts and explain them in simple terms of how they affect you as an individual, the intimacy of your health care, and as we talked about, the health and well-being of your children. So number one, we just need to do a better job communicating. You know, it's a little bit hard because people today don't trust government, they don't trust their legislators, they don't trust their churches, they don't trust their university presidents, they don't trust banks, they don't trust scientists coming in. But we do have to agree upon the body of facts that are before us and what the consensus of scientists, you're always going to find a scientist that says, an extremist, but what the consensus of scientists say today, and then explaining them of how they impact your health, your heart, your lungs, your ability to breathe, and then how they impact your community in terms of economic impact if you have a workforce that is not well and doesn't go to work or is afraid to go to work or is suffering from PTSD. So I think it is taking this public health approach and looking how it affects the individual, taking it to the public health level of the community itself, and then the role of how it impacts our GDP, and then what the government can do. And then put an action plan down and then measure it to see if what we're doing is working. And if it's not working, stop it and then move ahead. And that's why this participation in the government policy making is so important.
Well, something you mentioned earlier, which I believe is also very important for me as a scientist. I forgot which of our leaders said this some decades ago, but everybody's entitled to their own opinion, but not to their own facts. And so I think that what you've shared with us today just emphasizes how important that is. Senator, I can't thank you enough again for having this conversation with me. I think our listeners have benefited profoundly from your insights and your perspective. So thank you again so much. I do appreciate you.
Thank you very much.
Thanks for listening to Public Service Announcement. To follow along on the rest of our journey, visit www.mmc.edu. And please remember to follow, rate, and review this show wherever you get your podcasts.